Right team, can we start our primary survey? Penny, can you put some monitoring on? Rachel, how's the airway?
So Ben, can you hear me? The airway's taken.
Thank you.
Hi Ben, I'm Max. I'm another one of the doctors.
The clinicians carrying out the A to E assessment must be trained in the ATLS or ETC principles of trauma assessment.
So we've got a central trachea. Anteriorly there's no subcutaneous emphysema. Is anything sore here over your clavicles, Ben? Doesn't look like it. Anything down the front of your chest, Ben? Can you take a big breath in for me? Does it hurt at all when you're breathing like that? And keep going with those big breaths.
Are you warm enough, eh?
Yes, all right.
Yeah? Good. Goody. Just a few leads of your chest, sweetheart, and I'll just check your blood pressure in a minute. Righty?
So we've got no anterior chest wall tenderness.
Right,
We've
okay.
got equal bilateral air input. I'm just going to have a quick feel further down your tummy, Ben.
Matt, just brief carry on. What's the stats?
No? Not even in here?
So we're waiting for monitoring to come through.
Looks like 96%. That'll do me.
So that's a 96%. He doesn't appear to be in respiratory distress.
Thank you.
Give me a shout again, Ben, if there's anywhere that's sore that I find, okay? So the abdomen is soft. And then move slightly further onto the pelvis.
The pelvis should be inspected and carefully palpated by a trained clinician so as not to disrupt potential unstable fractures.
Quite a lot. Ben, do you mind if I lift up your gown? Okay. So there's a big bruise overlying the lateral aspect of the left leg.
Okay.
The proximal femur looks deformed. Is that sore there, Ben? I'll stop doing it then.
Okay, so we've got a tender pelvis, probable left femur fracture, and a tachycardia of 120. I'd like to carry on with the survey, prep for a wide bore cannula, bloods, cross match, healthy binder, and a Kendrick split, please.
So just moving distally down the limb. There's intact pulses there. And capillary fill is less than 2 seconds.
Right, Rachel, could you complete our disability assessment? And Penny, could you complete our E assessment by doing a temperature?
Ben, I'm just going to shine a light in your eyes, okay? Pupils are equal and reactive.
Okay.
Ben, do you know where you are at the moment? Okay, and can you just move your arm for me? Lift your arm up. Well done, good. Okay, so GCS 15.
Thank you. Penny, once you've done temperature, could we have a blood sugar as well, please?
Absolutely.
Okay, temperature is 36.2.
And apart from our femoral fracture, I can't see any other evident external hemorrhage or any other injuries in the current position.